Hi guys, I'm Nalima Pradhan and I welcome you back to my channel Exploring MS. I have been talking about my journey with multiple sclerosis and I've been living with MS for over 9 years now, and I do share my tips about how I have been able to manage to live with MS effectively. Right. So, there might be a lot of questions or confusions in everyone's mind. It does happen with me too, about the options of medications that we have, with when we are suffering from MS. Okay, now if you ask me, in my case, I had started taking Tecfidera, which was an oral medication, right, which did not suit me. So I had to be changed to a higher agent. And now the switch, when the doctor was suggesting me the options, there were so many that I really could not decide. And I'm 100% sure most of you might be going through that too. Your doctors might be letting you know that, okay, this is the medicines that you need to take, and you are not able to decide what to do and what not to do. Trust me, I have gone through that phase myself. In fact, I think I've spoken about this in my earlier videos also, that there was this doctor who was telling me about the injections. Now, the oral did not suit me, so my neurologist suggested that I should start taking the injection, right, the interferons. So there were so many that every medicine, the injection, he would tell me the name of it, and then the side effect, and then the cost. Everything, whatever he was saying, was just going above my head. I just could not comprehend, because there were so many. I just could not understand what to do and what not to do. And even when you're talking about interferons, these injections that I'm talking about, there might be some that you have to inject every week yourself. There might be some that you'll have to inject it once a month, going in, being at the hospital. There might be some which has to be done in 6 months, 1 year. So there are variety of it. So when you have so much of options there, which one will be the right one for you? How will you decide? I mean, ask me, I really couldn't decide because there were so many, right? And my treatment, I mean, my treating hospital and the doctor is in AIMS, and the one who had diagnosed me, he used to practice in Fortis in Gurgaon at that point in time. So, I was so confused with the variety of options that I had in my hand. I just called him, the one who diagnosed me, Dr. Divedi, and I told him that there are so many options. Which one should I go ahead with? And then I told him the names. I mean, few was like, rituximab. And then the moment Dr. Divedi heard this name, rituximab, he told me blindly go for rituximab. Because see, in AIMS, what happens is, like, doctors will ask you to decide which medicine would you want. Which medicine would you be comfortable in taking it? They will suggest, but they'll ask you, which one will you be comfortable in? Like in my case, the doctor was very much sure that it has to be interferon. Now, which interferon, that I had to decide as to which one will I be comfortable in. Now, how am I supposed to know that? Right? As a patient, I would not know which injection will suit me. I mean, I don't think anyone would know that, right? So I had no option. I called Dr. Divedi, and he suggested that take rituximab. And luckily, you know, from the time I have been taking rituximab, I started in 2017, and till now, we are sitting at the end of 2024. I take this rituximab like almost 9 months to 1 year in between. I haven't got any more attacks. Before that, I used to get multiple attacks when I was in Tecfidera. So luckily, thankfully, I would say that rituximab has suited me, and it has been working for me, and I haven't got any more attacks. In fact, even my MRIs are clean, so I have reached, maybe I could say, that state of NIDA, you know. So that's how it is. I mean, it's difficult to decide on which medicine we should go ahead with, because rituximab just suited me, right? And I've heard those kind of cases wherein people who started with rituximab did not suit them, and they started getting multiple attacks while being in rituximab, right? So I mean, we really don't know which one will suit you. I think it's all about hit and trial. That's what I would say. I mean, Tecfidera did not suit me, but it might suit somebody else. The same way, rituximab, it suited me, it might not suit somebody else, but I guess it's all about um, luck, by chance. But then again, like, we can't stop trying, right, till the time it clicks. Now I have been taking this particular rituximab, a medicine, for a very long time, and I really don't know how long should I be continuing with it, right? Because my doctor, Dr. Bhatia, who's treating me, he has already told me that, it's not, I cannot take it forever. So that this has to stop. Now when will it stop? I don't know. So yes, I'm still waiting. I mean, let's see how things goes. But whoever is confused about which medicine to take, I think all I would say is it's more like a hit and trial. You really can't be 100% sure before taking it that it will suit you or it will backfire. Like, you really don't know. But once it suits you, then you should stick on it. That is all I can suggest, after whatever I have experienced it. I hope this video helps. And if you haven't subscribed, kindly do go ahead and subscribe to my channel, guys. Thank you for watching. Bye bye.